Hello, friends. I think this is probably the 10th time that I've done this, so I am going to be as quick as possible and give you as much information in as little time that I can. um, so we sent out an update, or by we, I mean I sent out an update to certain people just letting them know, hey, I consented. This is kind of the plan going forward, when we're leaving, how long I'm going to be there, that kind of thing, or tentatively, I should say. Sun's a little bit bright. It was kind of vague, so I wanted to give kind of an updated, longer version so that people kind of knew what was going on. So clinical trials have a number that goes along with them. The one for mine is N as in Nancy, C as in cat, T as in Tom, 01591356. This is the EPHA2 gene targeting using neutral liposomal small interfering RNA delivery, and it's a phase 1 clinical trial. Dr. Shannon Weston is the PI of the trial. Dr. Nyang, which has been our doctor since day one, is the co-PI. The goal of this clinical trial study is to find the maximum safe tolerable dose for this drug. It is an investigational study. siRNA-EPHA2-DOPC is not FDA approved or commercially available. It is currently being used for research purposes only. There are no guarantees this drug will work, as we've obviously found out that some of them do not work. I go in it thinking they have a 50% chance of working, a 50% chance of not working. But the goal obviously is that it will help my cancer by either stabilizing it or getting rid of the tumors I have now. Any clinical trial that is approved by the FDA has to have efficacy for the patient in order for it to be approved. This drug is designed to shut down the activity of the biomarker called EPHA2. It works on the RNA level. So when Dr. Nyang was explaining it to us, he kind of drew a diagram, which I don't have right now, but to make it short and simple, DNA is up here, RNA is right here, and the protein, which is the cancer, is down here. This drug will be working on this middle section called the RNA to take care of the protein, which is the cancer. Easy peasy. This drug is, again, not FDA approved, which normally means that the insurance will not cover the drug. This is an MD Anderson made drug. The scientist at MD Anderson actually made this, so they will be providing this drug to me free of cost. Since I did a CT scan recently, they are not going to require me to do another one on top of all the other scans and screenings. I will be able to skip that as long as I stay within a 28-day window. It has to be 28 days from the time that I had the CT scan to the day that I will start the clinical trial. Right now, I think we're good. I don't think we're going to have to worry about it. The screening involves the following: a medical history, which they obviously have, but we'll have to go over it. A physical exam will be done just to make sure everything's still good. I will need to be able to perform daily activities, which I obviously can. Blood and urine tests will be taken, which it always is. An MRI and a PET scan will be done. Those have been scheduled. I just can't remember off the top of my head. There were a lot of appointments that I added to the calendar today. Core biopsy of the tumor to test for EPHA2 and other biomarkers. One is scheduled for the 21st of August. The other one's scheduled for the 24th. An ECG will be done, and a questionnaire about my disease symptoms will be done and completed as well. As long as financial clearance comes back fine, I'm pretty sure it has. I'm not sure that they would be making all these appointments if it hadn't, and it went fine for the other one, so I think it'll be okay. and I pass everything in the screening process, I will be enrolled in part 1 of this study and will receive the highest dose of the medication they are giving, not given. The previous dose that was given was 3,600. The dose that I will have is 7,200 micrograms. I think he said micrograms per something. I just can't. I've listened to it probably 20 times and I can't understand what the per is, if there is a per. So all you medical people out there may know what I'm talking about. Again, there will be no higher dose tested on this trial, so the highest of the highest, which is kind of scary, but it wasn't the highest of the last one, so maybe this will be our saving grace. 3 people have been put on this dosage. So far, all of them are doing well and tolerating it well. So I'll be patient number 4. 6 more participants will be added. I will receive siRNA-EPHA2-DOPC twice a week, days 1 and 4 of each week by vein over 120 minutes, plus or minus 10 minutes. Right now, I am scheduled to do the chemotherapy treatments, is what they call it, on Tuesdays and Fridays. So I will officially start, as long as everything goes well, on Tuesday, August 22nd. We will expect to be at MD Anderson around 5 to 6 hours during treatment days. Because of the side effects they're seeing the most of, which are fever, chills, and a rash, I will be given hydrocortisone, Benadryl, Tylenol, and dexamethasone, I think is how you pronounce that. Nurses can let me know if I'm wrong. It's a steroid to help decrease the risk of side effects. Each cycle will be 21 days long, so pretty similar to birth control. I think birth control, certain ones are 28 days maybe. So for the people that don't have birth control or don't use birth control or don't know what I'm talking about, the cycle will be 21 days. So on day 22, that'll actually be day 1 of the next cycle, and so on and so forth. Birth control helped me understand that on the first one, but I had to think about that one, as sad as that may sound. There are a total of 68 patients that will be treated on this study. All of them will be enrolled and treated at MD Anderson, as you know, this is an MD Anderson made drug. I will no longer be able to take the study drug if the disease gets worse, if intolerable side effects occur, if study drug dosing is delayed more than 2 weeks, if the disease completely responds, which I don't understand. If the disease completely responds, then that means that it's working. So maybe that's a typo. I don't know. I need to ask about that because it's super confusing. Or if I am unable to follow study directions, which obviously I want to live, so why wouldn't I? This is the first study of siRNA-EPHA2-DOPC in humans. I think it was tested on rats before. So the side effects are not well known. Based on similar drugs and on studies in animals, siRNA-EPHA2-DOPC may cause the following side effects. It's kind of one of those including but not limited to. First one is severe increase in blood pressure, which could possibly be a stroke, low blood pressure, dizziness and or fainting, chest pain, buildup of fluid in the tissue around the heart, severe heart problems, blood clots in a vein, possible pain, swelling and or redness, blood clots in an artery, possible organ damage such as stroke and or a heart attack, a stroke, headache, which I don't need any more of, fever, weakness, chills and or shivering, skin rash and or hives, opening of a wound and or delay in wound healing, which probably means no more tattoos, so sad for me. Mouth blisters and or sores, nausea, vomiting, inflammation and or blockage of the intestines, hole in the intestines, possible leaking contents into the abdomen, decreased supply of blood to the intestines, possible death of this organ, yay. Separation of a surgically connected bowel, possibly causing the contents to leak into the abdomen, double yay. Bleeding, such as nosebleeds, bleeding in the brain and or spinal cord, digestive system, coughing up blood and or bleeding in the lungs and or airways. Can't wait. Abnormal liver test, possible liver damage, joint pain, decreased kidney function, possible kidney failure, sore throat, difficulty breathing, blood clots in the lung, possible failure to breathe, or what they say most patients have experienced is infusion reaction, which includes possible fever, chills, shivering, nausea, vomiting, and or severe heart problems. siRNA, EPHA2-DOPC may cause an increased risk of infections such as pneumonia. So, I signed up for this yesterday morning at 11 a.m., I think, or somewhere close to that. So, yeah, Josh and I will be heading down to Texas August 16th, tentatively. Screening 17, 18, and 21. Starting the trial on the 22nd. Should be at the hospital probably literally all day long that day. And I'm looking for places to live. So I will most likely be down there for 6 weeks. Wish I could hire somebody for free to look for a place to live for me because it's exhausting. So if I don't answer the phone, that's probably what I'm doing, is looking at my phone at Airbnbs trying to find somewhere for me to stay. So be patient with me. I'm dealing with a lot. We appreciate everybody's love and support. And if you have any questions or concerns, I've made peace with all of this. So if you want to call me, call. If you want to text. If you want to message me. We'll give updates as we get them. And I hope you guys have a great weekend. We're going camping again. I'll talk to you guys soon.